My guest today is Dr. Monalisa Sur. Monalisa is a professor in the Department of Pathology and Molecular Medicine and an associate member of Department of Oncology, Juravinski Cancer Center and Hospital in Ontario, Canada. Among many laurels, Monalisa has been honored with the Leadership in Education Award from the Canadian Association of Pathologists in 2016 and the Distinguished Service Award for her contributions to the field of diagnostic pathology in 2022. Monalisa's commitment and dedication to this challenging profession is exemplary. She has taken on leadership roles as chair of the Mentorship Committee in McMaster University and as an exam board member at Royal College of Physicians and Surgeons of Canada. Monalisa is passionate about motivating more women doctors to take on leadership roles and stay the course. And I really appreciated the candidness and authenticity she brought to our conversation. Without further ado, let's jump into our conversation with Monalisa. Hi, Monalisa. Welcome to the show. Welcome to Atlanta Diaries.
Hi, Enma. How are you? Happy New Year.
Thank you. Wish you the same. I'm really excited for this conversation and thank you very much for sharing your journey with all my listeners. I'm sure it'll help a lot of them to get inspired to get into a profession like yours, which needs a lot of commitment and a lot of dedications.
Thank you for giving me this opportunity.
Awesome. So why don't we start with that, Mona Lisa? I'd love to sort of understand from you, how did your early years shape your journey thus far?
I come from a background where my father was a physician and my mother was a lecturer in Indian languages. Believe it or not, it was Sanskrit. So it was a house full of very busy professionals who had to kind of have excellent skills in time management, to give equal time to their profession and take care of the house and responsibilities. And I particularly saw my mother. I derived a lot of inspiration from her. She was a really busy professional, with my dad being a very engaged and active physician. She was one, taking care of the house, me and my sister, and also having a full-time job. And I saw her doing everything. And what I really admired about her, that while she was a wife, a mother, a kind of a homemaker, she also kept her own identity as somebody who was identified beyond being just Mrs. So and so. And she used to interact with her students. She used to mentor them. She used to give them advice. And very importantly, I saw that she was able to make her own decisions and she was financially independent. In her relationship, she brought in equal partnership. So I felt that was really important. And I think those initial years really molded how I looked at myself, how I looked at the world, how I wanted to shape my career in whatever it was, and be independent in many ways while being an equal partner in any relationship I was going to have. I mean, all that didn't come like when I was in school, but gradually as I saw my mother face challenges, it really shaped who I wanted to be and, how I wanted to control my narrative.
That's such a beautiful tribute to your mother, Mona Lisa. How come doctor then, like considering that she seems to be your role model, how come you decided to sort of take up the medical profession?
I think it was also a bit of reverse psychology because, my mom always wanted to go into the healthcare line. But during her time, and she grew up and she did all her schooling, her university in Patna University. But, in their family, women weren't allowed to go into field of medicine. It was kind of, while they were advanced, they were also a bit conservative. So I think she always wanted her children to go into medicine. And my dad was exactly the opposite. He felt that medicine was a long and gruesome career. You had to give 100% and more. And I was good at English. And he wanted me to go into arts and do English literature, go to London. And I just felt he didn't want me to go into medicine, and having my dad in that profession, growing up in an environment that had all physicians, you kind of tune yourself to it. You feel it's easier. So I don't think I had any strong motivation why I wanted to go there. I just felt that that would be nice, and I like biology, so I went into that. And once I went in, I really enjoyed it.
Mm-hmm. Yeah, it almost sounds like it was contagious, given that, you were born in a sector where there were doctors all around you.
Yes, and in the time when we grew up, environment played an important role, and opportunities that came to you and what kind of guidance you got. So I think that was important. We didn't have at that time the internet or the web where you could do your own searches. So that's how, if I look at my friends and my classmates who are with whom I kind of grew up, I think more than 80% went the route one of their parents were in.
Yeah, yeah, sort of role modeled it to them.
Yes.
Actually, I feel that at our age, we were that much more vulnerable and wanting to get to know more, learn more, get more guidance. We were craving for guidance. At least that's what, when you're talking about it, it takes me back to my growing years when anybody who came home who we felt was accomplished and, was successful, we wanted to get knowledge from them. We really wanted to extract as much as we can from them.
Yes, because in the 80s, other than few things on the TV, even that time, I think we only had, if you go back to India, you only had Doordarshan. You didn't have, and they had one and two channels, and the radio, and internet hadn't come, the cell phones hadn't come. Like, we were so technologically behind. I don't even know how we managed that time to we gather information. We had to gather information from the library, from the newspapers, and from what was told to us face to face. So the dissemination of information and acquiring knowledge was very different from what it is today. So a lot of it, I think, shaped who we were and which fields we went into. And I think our immediate role models who we saw every day were our immediate family members, because and our parents, because those are the people we interacted with most.
As I was listening to you about the medical school, and you said earlier that, your dad didn't want you to take it up because it was such a demanding profession, right? So I'd love to double click on what were the biggest fears, or like, I want to talk about your journey as you became a doctor. What kind of challenges came your way? Were there any times when you had self doubt, like, can I do this?
I always feel that it's very important for us to really enjoy what we do. We must never be forced into doing something that we don't enjoy and we don't like, because that kind of makes you feel resentful. You don't give your 100% to it. I always felt I wanted to do medicine. I really enjoyed the subjects I did. I always found certain subjects like pharmacology really difficult because everything was related to a little bit of chemistry and everything looked same. And there are always certain subjects you like better than others. I think the biggest change was because I always lived at home, and we were a nuclear family. It was a huge change for me to go out of town, and is something your parents never kind of really prepare you for at that time. You're just kind of thrown into it. You're protected, you're cocooned. So I went to another city. I had to stay in the hostel the initial 1 year. The first 3 months we had to share a room with three other students in the same semester. Then you were sharing a room with another person, and that's a big challenge when you come from a nuclear family where you had your own room. And I'll give you a small example. I always used to read aloud and learn, and we were sharing rooms. you can't read aloud and learn. So you have to go and sit somewhere else, or you have to stay in the library. And again, in the library, you can't read aloud and memorize and learn. So those are little adjustments that you have to do in your day to day life. That kind of might be stressful if you are not able to adapt to your surroundings. It might impact your performance in your professional career when you're starting your formative ages. Little things, you have to share the washrooms, you have to go to those washrooms from your hostel rooms. You learn how to go to the bank and withdraw your first salary, or write a check. These are things you would never really do when you are at home. So I thought, more than professional, your lifestyle changes were personal challenges for all of us. You are mixing up with different people coming from different backgrounds, from different schools, from different universities. So I think that is a huge lesson in how to adapt, how to make things work in the circumstances you are, and perform well. And it also teaches you how to manage your time, because you have to do a lot of things yourself that you didn't do when you were at home. So I think these are great life lessons that actually help you when you proceed in your professional career. At that point in time, you don't realize that, but I think these are things that strengthen you as a person to face challenges, welcome them, and to manage change.
You've given a very different perspective to taking on a medical profession. It almost sounded like this was like a foundation which helped you to make so many sacrifices or adapt to so many different environments. I know you moved from Chandigarh to Hyderabad, from Hyderabad to South Africa, and then from there to Canada. So, talk to us how that whole journey played out and what kind of sacrifices came your way.
I got married when I was in internship. And right after our marriage, we moved to Hyderabad, where my husband's parents were. He was the only son. So, he was also away from home for a very long time. And again, that was a big adjustment, going from hostel life where you are completely independent, you're doing your own thinking, you do what you want, to kind of an extended family where you have your in-laws, you have your husband. And while we were both professionals, again, it's a great and a significant change in your environment where there are different interplays happening. I was actually a non-local because I wasn't born there. And the only way I could write in India, it's full of entrance exams. Again, you have to write an entrance exam to get into your postgraduate degree in medicine, right? After you finish your MBBS. And the only way I could write the entrance exam was if you're born there, or you've lived there for X numbers of years, or you're married to a local. So my husband was a local there because he wasn't born there, but they had moved there. My father-in-law was in the Air Force. So he had moved there when I think he was in grade 5, and he did all his schooling, his university. So he was considered a local. So that's the only way I could basically sit for the entrance exam. So I got into postgraduate degree in Osmania University. And then my husband moved to England to do his fellowship. So 6 months we were apart because I was still completing my postgraduate degree in India, in Hyderabad. And that was a really tough time for us because I was also expecting my daughter that time, and he was not there. And when I look back, it was really tough. And I did have the support of my in-laws. They were wonderful people, but still, you want your husband there. And I was also doing my I was also going to university to complete my post graduation there. So sometimes your professional career you have to make those sacrifices. So he went for his fellowships in the UK and US. And, I was there with my daughter for those initial 2 years. And then he got a really good offer from University of Witwatersrand in Johannesburg. And he moved there initially for 3 months. He said he was going to try it out. And then he said, okay, why don't you come? And at that point, it was a really tough choice for us whether we move our daughter with us to a unknown land where we had no relatives, we had nobody other than just the two of us, or leave her with his parents who she was very comfortable with, and then decide what we were going to do. And so I left her with my in-laws, and then I moved to Johannesburg. And because my husband had already trained in the UK, in the USA, he didn't have to do anything. He went directly into a consultant position as a radiation oncologist. But I went through my entire residency again. That was a good 4 years, and that was gruesome because it was long hours, and sometimes I would reach work as early as 7 o'clock and be there till 9, 10 o'clock. And we just felt that it wasn't an environment where you could bring your daughter, because at that point in time, when I look back, we felt she was really comfortable and happy with her grandparents, and they would take such good care of her. So here at that point, we as parents made a sacrifice where we left our daughter, who was our only child, and she still is, with grandparents while we pursued our careers. And the reason I think why we achieved so much, both me and my husband, during that phase is because we were so focused. We didn't have our daughter there to take care of. And had his parents or my parents moved with us, maybe we would have moved our daughter with us. As young professionals, we just didn't feel comfortable. And, our thinking at that time was, we are going to spend long hours at work building our careers. It's better she's with grandparents than with a nanny or going to a daycare. And, that time the culture of daycare wasn't that much. Everyone had some family or relatives or had a nanny, and then there were costs involved. Like if you wanted to keep a full-time really good nanny, it was expensive. And we were in our formative years of our career. My husband had family responsibilities. So when we looked at our circumstances and what we could and couldn't do at that point in time, we felt it was better that our daughter stayed with the grandparents while we focused on our careers. And she would come for her holidays. She would come twice a year. We would try and go once a year. But looking back, it wasn't the same. And then we were there in South Africa for almost 11 years. And it was really good because we achieved a lot. We traveled a lot, just opened our mind to so many different opportunities, so many different ways things can be done. Because when you travel, you live in different environments, you gain so many different perspectives to life. It was a hard choice. Every time our daughter came to us, stayed with us during her holidays, and she went back, the first 1 week, we were so upset, both of us, and then gradually, we would get into our workflow, the flow of things, and it was a tough choice. And then when she turned 9, the situation in South Africa, although the healthcare was very good, we didn't feel comfortable given the political unrest, the crime rate, that we wanted to bring her there without having a consistent, sustainable support system. And, that's when we decided to look at different places. And it was just coincidental that time my husband and I were invited to Canada to give a series of lectures and presentations. And we did that, and we just went back. And then we never thought about it till we got some offers. It's all about being at the right place at the right time. Canada was experiencing a shortage of qualified physicians, trained physicians. So again, we were recruited here that time and we moved here with our daughter. So again, that started our journey here. And I told my husband, I'm not moving anymore after this. We have moved to 3 different countries. We've stayed temporarily in the UK. This is it, whether it's good or bad. And we had to settle our daughter. So at that point in time, my husband took a back seat. I got so much support from my husband, who himself is a really accomplished, busy physician, to carry on with my career opportunities here. And being in an academic center, there are 3 aspects to your career. You have heavy clinical work, you also have to do research, and then large part of your time is spent in education, educating undergrad and postgrad trainees. So it's a lot of time commitment. So my husband took a little bit of a back seat and we brought our daughter here. And the initial 3 years were really tough because reintegrating her in our life, making her realize we are her parents and her grandparents are not her parents, was a huge adjustment both for her and for us and for the grandparents, who felt that now they were being sidelined. It was a lot of interactions and a lot of tense situations, and having full-time professional career. But at the end, I think it worked out. And I think what really helped us here was that my husband and I really supported each other. It was like we came into this thinking it was an equal partnership. We didn't blame each other. You did this, I did this, you said this, I said this. We said, okay, this is our situation. Whoever was responsible, doesn't matter. Let's see how we can do it. And this is our goal. So that really helped us have a clear perspective of what we had to do, how we had to do it. And we also realized that we could take help from others. It's a realization that came later. So also financially, we were better off. So as a working woman, you feel sometimes guilty that you're not doing everything to perfection. You can't do it. That is a myth. And if people say that, oh, you can be a brilliant mother, you can be a brilliant homemaker, you can be a brilliant professional, they are lying. You can be if you have the support and you have help. You can do everything. And that's what we did. And again, it's a very fine line. How much help do you take from your parents or your in-laws? Because the more you take help from them, you're more dependent on them. And you can't make your own decisions. And particularly coming from South Asian backgrounds where parents feel that they can make all your decisions, it's a very fine line. These are real challenges you face, so you have to draw a line where, okay, you are the grandparents, spend quality time with your grandchildren, enjoy them, but we are the parents. We are going to decide and take help. Have a housekeeper, have a cleaning lady, even if it's not full time. Look for a good daycare, put your kid in extracurricular activities, have a reliable nanny who can drive her around. Those are things that really helps you in a way that you can, when you have to devote time to your professional career, you do it. The remaining time, you're not running around trying to do chores. You actually spend quality time with your family. And I think this is crucial. And this is how professional women succeed. And it's really difficult, but you have to do it. And you have to let go of not being a micromanager. And also, when you have support from your husband, if you're two professionals, you need to decide right on that the chores in the house have to be divided. This is a very practical point. I still see a lot of professional women trying to do everything because culturally their husbands feel that their work ends by going to do a job and then just coming back. And I think this is something that you work together as partners in a relationship. And I think that's very important. And this is our journey together.
It's such a beautiful partnership. Mona Lisa, you had to make so many sacrifices together, but sounds like just that whole communication and that honesty with each other and understanding that we are all in it together. I think that's what
Yes.
kept you going. Yeah.
Yes.
Did your daughter start questioning, why am I not with you and why am I with the grandparents? And did she later also sort of hold you responsible for keeping you guys separate?
Yeah, no, I think she didn't really question it while she was with her grandparents, because her grandparents really, they're lovely people. They really, my father-in-law has passed away since, but they were lovely people. They gave her a lot of affection. Yes, their parenting style, now looking back, would have been very different to ours, because now when you look at it, you realize as parents, your parenting style is a lot different, right? When she was with them, she never questioned, because that was the environment she grew up in. I think she started questioning and feeling resentful because once she was with us, there was clash of ideas between how she was brought up by her grandparents and how we were trying to bring her up. And that's when the resentment started happening. Then also, when she went to school, she faced social racism. That time in Canada was not that diverse, although there is multicultural act and everything. Things were not that diverse as it is now. Children can be quite unforgiving if they don't click. And her coming from India, her accent was a little bit different, and the way she did things were a little bit different. So she just found that whole experience very unhappy and challenging for her. And that's when she questioned, why can't I be with my grandparents? Why am I with you? And like I said, it took us a good 3 years to make her realize that we are her parents, we'll be there for her, we will help her navigate life as it comes to her. And whenever she would get angry, or she would have, not so much with her dad, but with me, as they go through their preteens, teenage years, all kids will have difference of opinions. And then she would say, oh yeah, but you left me. And then you had to go and try and explain to her. But she also realized, because she wasn't with us for those initial 9 years, once we reintegrated together as family, she realized that this time was precious. And she also learned that her mother is not always at home. Her mother is a working woman. She is herself a physician. So the time she gives me is important, and we should make the most of this time, and we should both try to value this time, both me and my husband. And when we were with her, we didn't let anything else interrupt that time. If there was a call from the hospital, we wouldn't take it, unless of course we were on call. That's different, and she realized that. But that time was for her. But both me and my husband felt, okay, the first 11 years of our life, focused it on careers. Now we have to focus it on our child. So that's just how we adapted and navigated through our careers. And then you have to make sacrifices. Things that you would have done during the day, you do it at night. It's never a 9 to 5. You spend time with your daughter, then you do things that you were supposed to do during working hours. A lot of my administrative work, a lot of my educational preparation for my presentations, I would do after hours. Sometimes we as women, we are very hard on ourselves because society look at us from a different lens, and then we start looking at ourselves with the same lens. And I think that's so wrong. Everybody is different. Everybody has their own strengths and weaknesses. We must realize our own strengths and weaknesses and capitalize on those. And it's okay not to be perfect. I always feel this is, your child doesn't remember how clean her room was. Your child doesn't remember, how clean the kitchen was, or what great food the mom prepared, or who prepared it. But she remembers good times that she spent with her parents, fun times that she wanted to spend with me or her dad. Those are the things they remember. So a lot of times we get so fixated in little things that we sometimes lose the bigger picture. Looking back now, I think that's the lesson I've learned.
That's really a lot of learning and a lot of understanding, Mona Lisa. Let's shift gears a little bit, right? So, the whole sacrifice you made is for the sake of your career. And looks like you were very deliberate about moving into leadership as a physician. And I'm sure that meant a lot of sacrifice and a lot of commitment. You were the first brown woman who made it to the chair of Royal College of Physicians. So, what kind of challenges did you encounter in that journey? And did you face any imposter syndrome?
It didn't come to me in a platter. I had to work through the ladder. I was a resident supervisor at my hospital site. From there, I became program director of my residency program. From there, I became voting member at the Royal College of Physicians and Surgeons of Canada. And while I was doing all this, I increased my profile. I used to do a lot of presentations, give workshops. People came to know me outside of my university. And the selection process, it's by nomination from different educational bodies, like our National Specialty Society, the Canadian Chairs of Pathology, and then they nominate, and then it goes through a selection process within the Royal College, and then they choose the best candidate. I never did things because I aimed to be the chair. That just happened because I had all the qualifications. But the process was, I enjoyed mentoring. I always enjoyed mentoring. I felt that I could bring in value to other women, particularly women of color who came to Canada as international medical graduates, and help them navigate their careers in a way, learning from my ups and downs. So I like being a mentor. I like teaching. And then I took some courses, like I took this whole master's certificate in healthcare management, which is given by the Shulak Business School in Toronto. And I also took another course called Navigating Your Way Through a Complex Healthcare System. So I took courses. I felt that would help me understand and manage leadership roles better. But at the end of the day, once you're in the job, you have to do a lot of things on the go. And yes, as women, we always suffer from imposter syndrome. We feel that we have to have all these experiences before, and I find this so consistent. Like for women, we feel we have to have all these experiences before we can take on leadership role. Whereas I find men just take it on just because they are men, and we'll figure it out and nobody questions it. Whereas we as women have self-doubts. And I think it's more so for women of color, because you always want to prove yourselves, you always want to be better. And I don't know how far it is correct once you are in that position and you have proved yourself and people learn to trust you and respect you. I think that fear and those insecurities tend to go away. But I think as a woman of color, particularly also if you're immigrant and you haven't been born and brought up in this culture, you always have those self-doubts, and it makes you always work harder and be more critical of yourself and always question yourself, am I doing this correctly? And I think those are challenges that you face every day, and you just have to navigate yourself. It really helps if you have a leader mentor who can guide you at the formative years of your career when you're embarking on a leadership path, once you've decided that you want to pursue leadership roles.
Any anecdotes or any examples which come to your mind, which you experienced and how you navigated it?
When I got the position of the chair, the vice chair, he was sort of a middle-aged to elderly gentleman, lovely man. I mean, really nice person. We had a great working relationship in the committee. And he comes and he says, "Oh, congratulations. But, this is a lot of hard work. I hope you're up to it." And I'm thinking, well, if it was a white man who had got this job, you would have never gone and told him that, oh, it's hard work and I hope you're up to it. And a lot of these kind of statements people make just because you're a woman. They think they have this conscious bias that because you're a woman, all this is going to be too much for you.
So, how did you respond to such comments, Mona Lisa?
I just said, yeah, we'll see how it goes. Because he also said it I think in a jovial way, because they all say these things in a jovial way as if it's a joke. It's not really a joke for us. And I said, if I could manage a busy clinical service, look after my house, look after my daughter, make sure that my educational and research mandate was fulfilled, I think this should be okay. I don't think this is going to be a big problem, This is a volunteer role, so I'm sure things will work out. And then I said, you're always there as a senior member. I can always ask you for your advice if the going gets tough. Don't you think so? And he said, oh, yeah. So you have to learn. English is a really good language. You can be very polite and yet be very firm and show them their place. And then you take help. Like, it's important that you don't let your ego stand in the way of being a good leader. So wherever you require help, because as a leader, you're not going to be good at everything. There are certain areas that you will lack knowledge, and that's where you go to your committee members who have that expertise and ask them for that help and acknowledge them for that help and appreciate them for that help and work as a team. Don't be a dictator and don't be a commanding leader. Rather, be a leader who facilitates, who gives opportunities, and who makes their team member be part of a project you're doing, taking their input and working together.
Interesting. Mona Lisa, any setbacks or any mistakes you think you made in your journey as a leader?
So I'm just thinking that it's always difficult to analyze and put forward your weaknesses. But one of the things that I have found as I grow older is because I expect the best from myself, I raise the bar for everybody. I used to get really angry with incompetencies, inefficiencies. I would snap at people because I felt, but this is your job. You should be doing it properly. Why am I there to tell you how to do your own job? And then I realized that everybody comes with their limitations. So, one of my weaknesses was that I used to have a short fuse. I would snap some back at people. And now I always count 1, 2, 3, 4, 5, 6 in my own mind. I try to explain it to them, or I'll say, okay, I'm just coming. I'll go away from there. And maybe in my room, I'll clench my fists, because in the healthcare system, sometimes mistakes, you're liable, right? As the primary physician. So you always have to be vigilant, but at the same time, you have to be empathic. You have to be patient with other people. And so this is one thing I'm still learning. I'm better at it because I'm a planner. I like to plan things. If I have to present a lecture like 2 weeks later, I will start preparing now. I'm not a person who can do things at the last minute. I'm a little bit regimented, and I think it's because that helps you with your time management. So when those things don't happen, I do tend to get impatient and angry. So I'm still learning how to calm myself and say, okay, it didn't happen now, it will happen later. And then trying to find out, how this happened, why it happened, and how we can not let it happen again. I also feel that as a leader, a lot of decisions are made behind the scenes. For example, we are going through a process of changing the name of our specialty to better reflect what we do now. And when we actually attend the formal meetings to disseminate information and knowledge to other specialties who might feel that they are being impacted negatively by your name change because it creates competition, as a chair, you have to be the face of being neutral, giving an opportunity to everyone to speak their mind. A lot of these decisions and discussions have to happen behind the scenes, where you de-escalate the fears, you give your opinions in a slightly stronger way than you would when you are in a formal meeting. And I feel these are important things: communications, how to communicate, when to communicate, and knowing how this communication will go. Who are the people who are going to be receptive to your ideas of change, and then will motivate the rest of the people to go along with those changes. So I think these are the challenges that you face and how you go about them.
Mona Lisa, this has been so interesting. And, as we sort of approach the end of the conversation, with the wisdom of hindsight in your professional or personal journey, would you have done anything different when you look back?
Yes, I think I would have taken my daughter with me when we went. Maybe we would not have reached the professional heights of success that we have achieved. But I just feel that we lost out on 9 years of her life that I really, really regret. As a mother, she was 18 months when we left her. And of course, we kept meeting her. It wasn't like that till she was 9, we never saw her. We used to see her 3 times a year, but those daily interactions, seeing how they developed through their milestones, that's something I regret as a mother. At that point in time, we felt that was the best decision. But now looking back, I feel we lost out on those 9 years. And they were important to us. While we have pictures, we don't have those real life interactions.
So, have you ever shared this with her?
Oh, absolutely. Yeah, we have a really, knock on wood, we have a really good relationship. She always comes and tells me everything. And, we do have our arguments. And sometimes I start with shouting at her, but then, then we calm down, and we have a really good relationship. And I've always explained it to her. And I think now that she is 30 herself, she understands it. She's a lawyer herself. She understands it better. She understands how careers, sometimes in careers, you have to sacrifice. So I think for us, it's all turned out good, for which we are very grateful. But that is something I regret.
Yeah, I really appreciate your coming out candid, because I think this is going to help the listeners form their own journeys and decide their own perspectives. Actually, that's the reason why I started this podcast, Atlanta Diaries, where just felt that through these conversations, I think the younger generation, the younger women will learn and, find their own journeys and their own paths. So any parting thoughts you have for young women as they transition?
I would tell young women that take on leadership roles, accept that challenge, find a mentor. That mentor can be anybody. It can be a man, it can be a woman. It's somebody you have a good wavelength with, who is your role model. So have a mentor very earlier on in your career. Go for leadership roles. Manage your time properly. Don't feel that you have to be excellent in everything and perfect. You learn from your imperfection. And not everyone has a very supportive family or a partner, but try and be financially independent. It's very important for women nowadays, given how relationships are forming, that you are financially independent. And in relationships, if you are both equal partners, it helps. If you're both professionals, learn to divide chores. I mean, there was a beautiful statistics, I can't remember where, it says a lot of resentments and disagreements and divorces actually happen with meager things like who will do the chores, who will cook, things like that. And get help, even if it is for a few hours. Get a cleaning lady, get a nanny, put your child for a little while in daycare. Always remember that to be a excellent mother, you don't have to spend 24 hours with your child. It's not the quantity, it's the quality of time you spend with your child. And same way it's with your partner, and prioritize what you want to do. If you want to be a homemaker, it's great. Be a homemaker, but enjoy what you do. It's very important for young women going into the careers that if you have to take a break and decide that I'm going to take a year's break and decide who I am, what I want to be, do it, so that when you go into a career, you are fully prepared, you enjoy it. And at the same time, I would tell people that if you really want to change your careers and you have the ability to do so, you're not enjoying what you're doing, have the courage to change that narrative for yourself.
That's such a lovely way to end it. Welcome what's coming your way and adapt and embrace changes. Thank you very much, Monalisa. This was really amazing.
Thank you so much for giving me this opportunity. I really appreciate it. And I hope my little stories help somebody.
That's why I'm so grateful to all the Atlantas who are partnering with me in this journey and helping other young girls find their greatness. So that's been amazing. Thanks for listening. If you enjoyed the episode, do hang on for just one more minute. I have a request for you. If you haven't already, please subscribe to Atlanta Diaries on Spotify, iTunes, or whichever platform you follow. Do join us in our mission to empower and inspire by sharing the podcast with a friend or colleague. It will be great if you can share on the social media platforms you follow, be it LinkedIn, Facebook, Twitter, or any other. Please leave a review or rating on iTunes or Spotify. It really helps us reach a wider audience. Lastly, I wanted to share with you that many of my coaching clients and listeners have created a cheat sheet with their key takeaways from the episodes. I invite you to consider jotting down 1 or 2 key takeaways as you navigate your amazing journey. Have a wonderful rest of the day and see you next week for another inspiring journey on Atlanta Diaries.